Good morning, everyone. Welcome to the September meeting of the Human Services Committee. Roll call of members.
Martini absent, Bazile absent, Bliss
Here.
Brockway
Here.
Mendez
Here.
Thank you. First order of business is Jeanette.
Thank you. I would like approval to pay criminal court in the amount of $141,247.26. This period is from July 1st, 2025 through July 31st, 2025.
We don't have a choice. Then I will make the motion.
Second.
Any questions, discussion? Roll call vote.
Martini absent, Bazile absent, Bliss
Yes.
Brockway
Yes.
Mendez.
Yes. Thank you.
Motion passes.
With that approval, I will need a budget transfer from contingency in the amount of $141,247.26. A transfer from A1990-548000 to A4390-546960 for criminal actions.
So moved.
Second.
Any discussion? Roll call vote.
Martini absent, Bazile absent, Bliss
Yes.
Brockway
Yes.
Mendez.
Yes.
Okay. Motion passes.
Thank you. My next one is approval to pay an employee for a total of $26,250 at $8,750 per payment. And this is from OMH Community Mental Health Loan Repayment Program, round 3. None of this is county money. And the state had put out a kind of repayment for people who have loans. They could apply as long as they work full time. And we filled out paperwork applications, sent it in. He was approved. I believe Steve had to sign a county contract and some special system. The employee has signed a contract for possible repayment should he leave employment before the terms of that contract run out. Everything is signed. We're just waiting for Steve to co-sign the employee contract as long as the board approves.
And because this is a contract, we'll need a resolution at the board doing that. So the request is to do this, and we'll request a resolution going on to admin and then to the full board. And then we'll just sign that thing and be done.
So this is a loan they took out for what reason?
It's a student loan that he took out for school, but then the state pushed out to employees where they can get like a loan repayment forgiveness payment to them, as long as we're able to verify that he is paying on a student loan, which I have done all the stuff needed for that. So as soon as we can get this contract in, we start receiving the payments.
And this money's coming from the state.
Yes.
This is one of the best tools we have for recruiting in these difficult to fill positions.
The loan repayments.
And we've talked about this at this committee and at least 7 years ago. Just takes a while.
Just making sure we got all the details straight. So I probably should have a motion first before we discuss.
I make the motion.
A second.
Second. Any further discussion? Roll call vote.
Martini absent, Bazile absent, Bliss
Yes.
Brockway
Yes.
Mendez.
Yes. You have some budget modifications from budget line A444900, which is our OMH salary sharing, and the total amount of $33,770 it's going to be split between 3 different lines. The first line would be A4310-545000, our materials and supplies, in the amount of $3,500. The next budget line would be A43105480000. It's up our other budget line for $200. The third line is A4310-549000, contracts in the amount of $30,070.
Motion,
So moved.
Second, sorry.
Sure.
discussion, comments? To the use of all. Okay, roll call vote.
Martini absent, Bazil absent, Bliss,
Yes.
Brockway,
Yes.
Mendez.
Yes.
Motion approved.
Thank you. I would like approval of the quote from our clearinghouse and Invalon, I believe they pronounce it correctly, 17,124 for a year. This includes an increase of our annual claims transactions from 7,200 to 10,000, which would help us avoid overage charges. Towards the end of the year, we always get an overage charge bill from them based off of how many claims we submit per year. Is that it also adds to the insurance discovery, which would help us find clients' insurance using just their name and date of birth. Currently, our system, we put in, John Doe, Blue Cross Blue Shield, this information. If he's not active, it just gives us a denial. It doesn't search any other insurance platform. So we have to either wait for the client to come back in and hope he has the insurance information, or if he's lost a contact, we don't see him again to get that information. Very helpful for clients who either, again, don't know coverage or forget to provide it to us. This does not include a couple items that we already currently have, as a platform fee of $5.98, and regular insurance verification. So adding all of that up, it will come to 17,124 annually.
So moved.
Second.
So this is new coverage, not additional coverage.
Well, we currently are with them for a clearinghouse, but they are starting to offer additional services, which we would find very helpful in the current situation that we're in. We do lose a lot of money when we don't have the right insurance information, and clients could be a loss of contact. Sometimes we don't know that for several months, waiting for the insurance company to send us denial that the client's no longer covered. So we picked a few extra items to add to our current contract with them.
So if I'm reading this bottom last sentence correctly, currently we're paying a little over 300 a month. And this would raise it to 1427 a month for,
1,427 per month.
any other questions? Roll call vote.
Martini absent, Bazil absent, Bliss,
Yes.
Brockway,
Yes.
Mendez.
Yes. Thank you. And then the last one is just a FYI, we have a write-off in ARS in the amount of $1,032.58.
Could you explain that a little more?
So when we hire, our job descriptions say people have to have their MSW, which they just graduate from college. They are not licensed yet until they take a state exam. Until they are licensed, we cannot bill for them. So this individual we hired, she was an intern with us for a year. We hired her when she completed, her master's program. I will say she just took her exam this past Saturday and passed, so now we can start billing for her, but in the time frame for her to take her exam, we're unable to bill for.
Okay, thank you. And we don't need to vote on that, that's just information.
Just information, so you know what's going on.
All right, thank you.
And that is all I have.
Okay.
Thank
Anyone
you.
need the
Have a good
executive
day.
session anymore?
No.
No. All right, thank you. You are.
So we'll start off with fiscal and Cheryl.
Good morning. Starting with the welfare admin report. You're within a reasonable range for all lines. Overall percentage is 40.91%. Records management, 56.18%. Agency housing, 54.07%, both within range. Moving on to the program areas. We are running a little high in POS, family assistance and safety net. But overall, our percentage is at 55.20, which is in range. I'd like to request a budget transfer from personal service line 6010-510010 to contracts 6010-549000 in the amount of $37,450. This is to contract with the county attorney's office for services rendered.
37,450.
Yes.
Motion.
So move.
Second.
Any discussion? Roll call vote.
Martini absent, Bazil absent, Bliss,
Yes.
Brockway,
Yes.
Mendez.
Yes.
Motion approved.
Okay, we'd like to want to fill a temporary social welfare examiner for the heat season. We have a retired employee that comes back every year and helps with heat. For 7 months.
Motion.
So move.
Second.
Discussion. Roll call vote.
Martini absent, Bazil absent, Bliss,
Yes.
Brockway,
Yes.
Mendez.
Yes.
Motion's approved.
Thank you. Okay, the personnel, we had 7 new hires last month, 2 clerks, a caseworker, grade B supervisor, and 3 examiners. And we have 5 new vacancies, paralegal, 2 clerks, town clerk typist, and a grade B supervisor. Two.
You're above water.
Okay, for housing, at the Otsego shelter, we have 6 families. Motel 88, we're utilizing 6 rooms. Crossroads, 20 rooms. Genie's 0 right now. And agency housing, 9 homes are occupied. Just had someone leave, so we're in the process of filling the 10 homes.
How
And
many
for,
rooms are there at Crossroads now?
They can take 22, I believe, total. Yeah.
And for OPD stats for the month, since last meeting, there were 6 emergency calls, and 2 of those calls involved DSS housed individuals.
That's all we have.
Okay. Thank you.
Great, thank you.
Thanks.
Anyone back? Eight 25, we're a couple minutes ahead. Is Tim gonna be here or not gonna? Maybe if not here. So on you, well,
Okay, work on my issues, not work me over.
right.
Thank you. We've just got one thing. We are We are requesting a resolution to continue our contract with Bonadio. Medicaid clients. Support. Pretty straightforward. Our agency compliance coordinator is here. That would be Alan, who can answer anything.
So just a quick, maybe.
Yeah. Yeah, so we've been using Bonadio for the last 2 years to get the compliance program up and running, which we should have had much earlier, but didn't realize until kind of a little bit later in the game. So we meet with them regularly. They consult and help us with the program, making sure that we're following all the compliance policies and being compliant and doing a lot of management and oversight of our Medicaid billing and Medicaid processes.
Is this one of the part of a, not automatic, but a scheduled review, or doesn't require bidding?
This is going to be the third year, so when it went out to
Third year.
bid, yeah, we
Yeah,
had
that's
1
what I
year
meant
with
by
two
that.
1 year options, and this will be the final one.
Final of the 3-year options.
We'll
Yes.
need to recompete next year. Bonadio also helps us, every so often we'll find a particular problem that needs a deeper dive, and this contract provides that, as well as other help for us that we may need. We are working on some IT issues and community services, and they provided some very helpful technical support in that regard, so I would say we are pleased with their support.
Okay, and looks not to exceed 82,000, it says.
Yes.
Probably should put that out there for the record to people watching at home.
Yes.
And it's for November 1st to October 31st, 26.
Yep.
Motion,
Second.
roll call vote,
Martini absent, Bazil absent, Bliss,
yes,
Brockway.
Yes.
Mendez.
Yes.
Thank you.
motion passes.
No. This is the calm before the storm. We'll be talking to you about the budgets later, and that'll be a very different conversation. Right.
So, okay, we'll move back. I guess we don't have anything else other than waiting now for Kate and Heidi to get ready.
Gee. You guys do great once you get rid of Jim Adrian. Of course, I'm doing my part to contribute.
I was gonna say,
I'm saying hardly anything.
yeah. You said that, I didn't.
Thank you for your support.
For a man of many words. You did well, sir.
Right. Well, now I think for the new year, I'm gonna work to a new goal. Instead of maximizing the number of words, I'm gonna go for syllables,
There you go.
right? Which is a problem. I'm overly educated, but not in the right ways in terms of counting syllables, so.
Actually, we're almost every time anyway. So.
Here.
There she is.
Long as you're excited, then yes, you can.
Morning, Tammy.
Oh, you're muted.
Muted.
All right, are you ready for me?
Yes, we are. Thanks.
Okay, sorry about that. I'm
It's all right.
at our leadership conference, so I apologize if there's background noise.
Oh, you're on time. We were just running early.
Okay, great. So my first request is to approve the purchase of a handicap minivan from Fenton Mobility, not to exceed 65,000. We went out to bid for this with Onondaga. We received, I believe, three, for the van. This is a vehicle they actually have on site, with the handicap ramp already installed and everything. So we would be able to receive it here within the next month.
So moved.
Second.
Any other questions? Any new questions or comments? Roll call vote.
Martini absent, Bazil absent, Bliss,
Yes.
Brockway,
Yes.
Mendez.
Yes.
Motion passes.
The second request is to approve the purchase of two convection ovens for central kitchen. This would be through Culinary Depot, not to exceed $19,000. We received 7 proposals for this particular item, and Culinary Depot was the best bid on that.
So moved.
Second.
Any discussion? Roll call vote.
Martini absent, Bazil absent, Bliss,
Yes.
Brockway,
Yes.
Mendez.
Yes.
Motion passes.
Okay, and then the third request is to contract with Important Films Media. That's a local production company right out of Gilbertsville. We would like to work with them to create some short form videos. We'd like to do one foundational video, which would be less than 10 minutes, just to talk about our office and aging and helping families to plan better and to also reduce stigma around aging and caregiving. We know the next 20 years for us are going to be, a huge partnership with our community and helping to support our aging population. And this would be not to exceed $19,000 and would be paid out of our 100% funded state grant.
So moved.
Second.
Any discussion? You said they're out of Gilbertsville?
Yes.
Who knew?
Yeah.
Hold on, I have their.
Yeah,
Yep.
that's what.
They actually attended our senior picnic last Wednesday, and were able to just start getting some footage and stuff, but understanding kind of the culture of our community and the dynamics and they see it as well, certainly within their own community.
Roll call vote.
Martini absent, Bazil absent, Bliss,
Yes.
Brockway,
Yes.
Mendez.
Yes.
Motion approved.
Okay, that's all I have today.
All right, thank you.
Thank you.
Highly and we'll again ahead of schedule, so.
I'm next on the schedule.
Right.
I didn't know you were here. Looking for you on the computer.
Yeah, usually I. Oh, we're gonna start if Adam can hold up, PowerPoint, just to go over the community health assessment and the process that we've gone through so far, so Addie's gonna go through that. If it doesn't, well, they did bring the USB too. All right, so it's good to go.
Yes.
All right, perfect. So, every county in New York State has to do what we call a community health needs assessment, and then based on that needs assessment, write a community health improvement plan. It used to be every 3, right? Every 3 years. It's now every 6 years. So we write this in partnership with our hospital system. Our county is very lucky because it's one hospital system. Other counties are working with multiple. So we've been working with Bassett to do this needs assessment, which we have officially completed. The survey is closed. And now we're in the process of analyzing these results. You know, what are they telling us and where are we going to move from here? We're a little ahead of the game because the hospital's community service plan is due in December, where our improvement plan is not due till June of next year, but we obviously want them to go hand in hand with each other. So go to the next one. Okay. So these are the demographics just from the respondents. We got almost 3,000 respondents, which I believe is a really, really good response rate. Just some of the demographics, 95% did report that they were year-round residents, but we did take survey responses from people that reported that they lived here seasonally, but more than 4 months out of the year. Most individuals that responded were over 65. Most were female, white, non-Hispanic. Most were retired, but I did like to point out that 3% did report that they are working multiple jobs. So that just shows that we do have quite a few people in this county that work multiple jobs. Most had a graduate degree, and then 78.9 reported to owning their own home. I was really happy though. It does say 0.2%, but we did get some individual responses that actually were homeless or living in a shelter or a car, which I think is good to point out because we got some of those, you know, demographics that we don't traditionally hear from. This real quick, it's kind of small, but this is just a map of where our survey responses came from. Some we did only get 1 to 2, but there was not a single zip code area in our whole county that we didn't get at least 1 from, which again, I think is really good. Obviously, Oneonta, Cooperstown were our highest survey responses, but it's still important to see that we were successful in getting the whole entire county covered. So now I'm just going to go over some of the questions that were asked and the responses. So first we asked about, you know, our community assets. What are we doing well? Talking about the people in the community, a lot of people reported that we have a friendly, helpful, and supportive community, and they feel really connected to the people who live here, which is good. Thinking about the services and resources in our community, 17.5% said healthcare, which I think is interesting because you'll see that that is also a highly reported barrier. So I think people in our county are really recognizing we do have good healthcare systems here, and that, you know, if we could find ways to improve them as a whole, that would really be a good community asset. I think the, you know, hospital system, the health department here, we have good resources. We just need to amp them up a little bit. And then access to local businesses. Quality of life, a lot of people said safe place to live, little or no crime, and the informal, simple, laid back lifestyle. Activities, they like that there's a lot of local events, festivals, and there's year-round access to fitness and exercise opportunities. And then the activities in our community, again, I just repeated that, the local events. So now talking about the community concerns, when we talked about the social and environmental health in our community, 17.2 reported that they believe there's not enough affordable housing or there's too much homelessness. And then 11.9% reported that there's not enough jobs, livable wages, or not enough that they feel to live on comfortably. And then thinking about the availability and delivery of healthcare services, 24.3% reported the availability of primary care providers and nurses was a concern. And then the ability to get appointments for health services within 48 hours was a concern. So then we broke it down even further and asked everybody, what do you believe are the top concerns for the youth population, the adult population, and then the older population? So I'll just go over them quick. For the youth population, the biggest concerns were overuse and misuse of social media or technology, mental health, and then substance use, including misuse of prescription medications. For the adult population, the number one was overweight and obesity, mental health, and then not getting enough exercise and physical activity. And then the senior was the availability of resources to help the elderly stay in their home. And then the ability to meet the needs of the older population and the cost of long-term or nursing home care. So then we took all of those responses and looked at the community feedback, the open-ended questions, everything. And these were the top 5 pressing concerns from all of the responses. These are in no particular order. So not enough affordable housing or homelessness, availability of primary care providers, availability to get an appointment within 48 hours, overweight, obesity, and diabetes, and then mental health for both youth and adults combined. There were definitely responses for the senior population as well. So just really quick to break these down. So 511 people said that lack of affordable housing and homeless was a top issue. In the survey, there was a section for open-ended comments. You know, I just kind of wanted to give people a place to lay it all out on the table, and then we can just analyze them. Affordable housing, homelessness, and poverty were just repeatedly cited as issues. And then only 10.9% rent their home, so majority do own their home, but 3.4% reported that they were actually worried about losing their safe housing in the very near future. Primary care providers, 24.3 or 721 responded that this was a barrier. A lot of people described difficulty recruiting or retaining doctors here, long waits for appointments, and concerns about losing local health centers. There were a lot of comments that, you know, all this was provided to Bassett as well about the Cherry Valley Clinic Center potentially closing. I don't know the details around that, but there were a lot of people that reported that if that gets closed, their access to healthcare is going to significantly decrease. And then provider shortages, you know, too few physicians, too many vacancies, and then difficulty accessing specialty care specifically. There were a lot of comments about people who need infusion for certain specialty services that they actually have to travel quite a ways to get. So availability to get appointments within 48 hours, this, you know, kind of goes hand in hand. But 608 respondents reported that that was an issue. Additional barriers, you know, there's not a lot of evening or weekend access, availability of specialists, and then transportation to and from certain medical appointments was an issue. A lot of people reported that the Medicaid cabs or the typical form of transportation is unreliable in this area. That was just a big comment, not my opinion, just comments. And then free responses noted that sometimes it is actually 6 to 9 month wait to see a specialist. And then obesity, overweight, and diabetes. 487 respondents reported that this was a top health concern for adults. Not getting enough exercise or physical activity was also noted by 307 people. And then wellness and disease prevention gaps reflect the demand for care services. So, you know, one of the community assets was 24 access to these local fitness centers. But seeing this, it seems like people are not utilizing them appropriately, or maybe don't know about them, or there's other access barriers. So that's something we can look into a little more. Mental health, 477 reported mental health as the #1 youth concern, and then 467 responded for adults. Seniors, there was a lot of responses, 105 that reported social isolation as a key challenge. And then we also asked people in the past 12 months, did poor mental health or physical health prevent you from doing daily activities? And 12.1% reported that mental health was a barrier and did prevent them from doing their daily activities within the past 12 months. So that is just a very, very overview of the responses. So what we're doing next on October 14th at Morris Central School, we are partnering with Bassett to do a community forum. We're inviting both community members, stakeholders, anybody who, lives, works, plays, cares about Otsego County to come. And we broke those concerns into 3 priority areas, which is what we need to do for our community health improvement plan. So we broke them down into integrating healthcare services. So how can we all work together better? I at least think in Otsego County, we have a ton of really great resources, but I just think that there's better ways to bring us all together and work together better. Mental health, and then nutrition and physical activity. We did nutrition and physical activity instead of just overweight and obesity because that allows us to tie in, food insecurity, access to fresh fruits and vegetables and everything in that category. So when people register for this event, we're asking them, rate those 3 priority areas to what you're most interested in. And then we're going to break people down into focus groups and then hopefully come up with some potential strategies or, what could we do? Opportunity for Otsego just did their community health needs assessment and they did their stakeholder forum like this, which Alex and I attended, and it was done very well. It was very productive. So we kind of adopted that. It was very much productive in the way that people weren't going there and complaining and saying, well, my doctor did this. It was, okay, this happened. This was a barrier for me. What could we potentially implement to reduce or mitigate those barriers? So that's our next step. We did just release that registration yesterday, and there's a couple other routes that we're still planning on releasing that through. So that is everything. That's my email. If anyone has questions or wants more information on that, I'd be happy to do that. I would be, happy to do this again too, once we have that stakeholder group and kind of see what kind of feedback we get. But we're doing it in partnership with Bassett as well. We're kind of taking the lead on that because I really just don't want people to show up just to, attack any one organization. But there are going to be leaders from Bassett there as well. Does anyone have any questions about any of that stuff? There's a lot, I know.
It's available on the website, the results of the survey or?
Not yet. It will be in the community health assessment. So when that document, it should be done by the end of the year, then we'll provide that to everybody and that'll be on the website.
Is there any chance we could get this PowerPoint sent to the board members?
Yeah, sure. Yep, I'll send that along with the invitation to the forum.
And is that forum just going to be in Morris or will it be others in other parts of the county?
We're starting in Morris. We're hoping that we get quite a few people, and that's why we tried to pick that central location, depending on what the audience looks like there. Then we might do a couple more. I would like to get down to like the warming shelter or certain targeted areas. I can't
Maybe
right
like
now.
small-
The older adult community in Oneonta, is it Connections?
The gathering.
The gathering place. I'd like to go there to target specific groups, but
Question on the Cherry Valley concerns.
Mhm.
Was there a particular demographic that was worried about that?
Go ahead.
I didn't look. I can pull that data, but I didn't, so I don't know.
It's a federally qualified health center. So I think they're afraid of losing their funding or they are losing
Well,
their funding.
Problem there is that health center is not run by Bassett. It's just contracted with Bassett. It was run by the town. And the costs dramatically escalated the last few years and it cost literally they had to raise their taxes last year. The town tax went up like 25-30% because of the cost of the health center. And it was gonna go up that much again this year. So, they're flowing through the tax cap. So the town was talking about disclosing it. And there's been several meetings. And it appears there's gonna be a solution worked out with Bassett, the contract, to keep it open. But yeah, there was a lot of concern that was gonna close because everybody in that part of the county was using that for their primary care.
I don't
So-
think people realize that it was town.
It was town run, it
Yeah.
wasn't Bassett run, and that was the issue, because most of them are
Yeah.
Bassett run.
Right, right.
Right.
That was one of the first ones, that was like the first clinic in the county.
Yep.
Bassett way back before they opened all the rest of them.
Are they vulnerable to the Medicaid cuts likely?
Yeah.
Yes. That
I'm
was-
guessing that if they're a high elderly population that they don't see very many young
Okay.
people or families.
And there was also a lot of people using it that, because Cherry Valley's kind of, scary county, Montgomery County right there, and the school district crosses those boundaries, and so there's a lot of people from out of the county using that as well.
Mhm.
And it was a very high volume clinic.
Mm-hmm.
I suppose if it does close, the next closest one is probably Sharon Springs, maybe?
Yeah.
It'd be like
Richfield.
Richfield, Sharon Springs,
Yeah.
Cherry Valley,
Yeah.
or
And that's depending on where you are.
Yeah.
Cobblestone, some of the people are not far from Cobblestone,
Right.
so. But it's also helped the Cherry Valley School now has an
Yeah.
in-school health clinic now, or a
Right.
school-based health
Yeah.
center, so that's helped as well, but it appears, last I knew, things were moving forward positively.
Looking better.
I think was gonna sail.
I don't know the answer to that, but.
Well, one other question, you mentioned right at the very end that OFO was doing their own assessment.
They did one, I don't know who mandates them or if they are, their schedule, they are actually on every 3 years, but it's the year before ours. Which was great because we were able to use a lot of their responses for this information as well. But yeah, we went to their stakeholder meeting
Yeah.
and it was well done.
Are there other mandated health assessments in general, or is this the main one?
This is our main one, and it's tied, like she said, to the hospitals, the community services plan and their IRS mandates.
Right.
Outside of other than us and Bassett, I don't know that OFOs, if it's mandated,
Yeah,
it
I
might be
don't
for
know.
their grants, but,
Right.
Yeah, I'm not sure either. When I was talking, I can't remember her name, to the executive director, but she said they do it every 3 years. But I don't know if that's in their decision, if they're told
because
to.
really they could use ours, they
Right.
don't have to do it, but
Mhm.
they could.
Well, it's just, the other thing is, depending on the details of the assessments, you may be building up a really rich database.
Yeah, yeah, because theirs is more family, right,
Right.
oriented, younger.
Um, Thank you.
Thank you.
So that's been keeping us busy, keeping Abby and Alex busy. We've been, this is the first year since I've been here that we will have written the plan ourselves. In the past, we contracted with somebody to write it and then, so paid 20 to 30,000 to have it done. And then the past several cycles, Bassett has done it, through their, community foundation office, which they don't have anymore. And so having Abby's position, the public health educator, has really paid off, and allowing us to do that in-house, so. Okay, so the first thing I have, is to approval for 2 people to attend the National Association for the Education of Young Children, conference in Orlando in November at a cost not to exceed 3,000. This is 100% grant funded through the Children with Special Healthcare Needs Grant.
So move.
Second.
Discussion? Roll call vote?
Martini absent, Bazil absent, Bliss,
Yes.
Bronson. Mendez.
Yes.
Motion approved?
Thank you. The next is, Abby, right, you can speak to this, the NOx box. We got another free, distribution box for our NOx zone. And we would like to put it out here, right, and in the lobby,
Main lobby downstairs.
Yeah, yeah, we have. And then you can tell them where the rest of the ones are. 'cause I
Yeah, so we
forget.
have the ones that we got for, the two that we got for free, the one is in the beginning, or right in the entrance of the Meadows. This one would be great here, we have two at Southside, which we have been filling multiple times a week. We have one at the Church, Christ Church in Cooperstown, one at Cherry Valley Library, one at the Co-op in Richfield, and one at a church in Oneonta that I cannot remember the name of. I feel really bad about that. But those were actually received through a grant through Oneonta Rotary. And we just partnered with them to help them stock them, supply them.
How much do they hold?
It's so it looks like one of those older the newspaper dispensers, so it's really up to,
You
they
put
can
lot
hold
in
a
there.
lot. Yeah, I typically put about 24 doses at a time in there. Not that I think people are going in there and cleaning them all out at once, but it's just easier for me to track how many doses we're actually giving out.
This is not Narcan.
Yes,
Yes.
It is Narcan.
Yeah.
yes, sorry, yes,
Okay.
yes.
Now I understand.
And so if you guys approve, then I'll take it to public works. Get there.
We need to vote on that, I suppose. That can be just voice vote. I'm assuming we need a motion.
Well, I can make a motion.
Yeah, we'll do it just in
Okay.
case.
Yeah.
Voice vote, all in favor, say aye.
Aye.
Aye, opposed. Abstentions, hearing none, motion passes.
Thank you. And then I have a couple of things that were added on, last minute. The, next is, approval to apply to host the IRT medical mission. Tammy, reached out to me from planning. We had applied in 2023, but did not get it. It was given to Broome County. So she is looking to apply again, and this is where, we'll partner with Bassett, and OFO to have a medical mission, so people could get free healthcare. I think it's a couple day event, usually they get free glasses and like all kinds of things, so.
This is when the military comes in
Yes,
and they
yeah.
provide all their services.
Yep, yep. So she's gonna take it to her parent committee, and I'm bringing it here today.
Need a motion for that? So,
No,
Second.
The IGA meeting. Yeah, apparently has been canceled.
Oh, so she's not taking it there today.
So she's not taking it. So if there is a timeline,
There is, yeah,
then maybe the recommendation for here is to go directly to
admin.
admin and just have her inform IGA. I mean, I'm pretty sure we're gonna have to have a special IGA, but likely it'll be before the board meeting, I'm guessing. You know, like we often.
why would it need both committees approval?
I'm not sure if that's just what she did last time, or maybe it's just, I don't know. She just asked me to bring it here today, so
This is who else you bring?
Tammy,
Tammy.
Harris.
Harris.
So it's a planning thing, so she wants her committee.
But I think because it's medical related, she wanted this committee to be
Right.
on board with it.
She could just email. Would this need to go to admin at this stage?
I
Or
don't
do we need a resolution?
know, because it's just applying, right? You don't have
Yeah.
a resolution to apply for the grant or whatever, apply for the mission.
You think it needs more than one committee approval? I mean, Tammy's committee. You're talking about Tammy Harris, right?
Mhm.
Yeah.
So her committees are slacking. IGA on occasion.
Right.
Yeah.
Well, yeah, most of our planning, I assume this is a planning, but maybe this is an environmental concern. Bad teeth.
It comes through the military, it's a public.
Yes, yes. It's a like a medical mission that the military sets up.
I mean, I think just because it's actually intergovernmental, that it might need IGA. And it does kind of fall directly under, yeah, sounds like it.
Well, my recollection in 23, this generated quite a bit of discussion. I don't think anyone was opposed to it,
Right.
but it was like, oh, how are we gonna do this? And just a lot of people had thinking about it. I don't,
Shouldn't be quite as complicated since we've done it before, though.
Right, the application should be, right, should be not too much to put into it, just
Well-
update it,
We can vote, there's no cost, right?
right?
So we can do a voice vote. All in favor, say aye.
Aye.
Aye. Opposed, say nay. Hearing none, motion passes. And I guess on our duty.
Yeah, I'll just tell Tammy, yeah, you know,
maybe she was intending to bring it to SWAC,
I think she said IGA, but.
and I'm pretty sure like.
Yeah.
So we'll just maybe catch them up or she can email them.
Yeah,
if that's okay.
Okay with me.
okay. And then the last thing was approval to purchase jackets and shirts with department logo. This is 100% grant funded at a cost not to exceed 1,700. And this is with our public health infrastructure grant funds.
Second,
Discussion. Roll call vote.
Martini absent, Bazil absent, Bliss,
Yes.
Brockway,
Yes.
Mendez.
yes.
Thank you. That's all I have.
Thank you.
Yeah.
Blue plan, and just, they come.
Yeah, the COVID flu should be no problem. That's nothing's changed with that, but the COVID vaccine, we've been, you know, if you've heard the stuff in the news, the executive order that the governor put out will allow us to provide vaccine to people. So,
We could have provided before, this would have been
a script.
cost or insurance.
Yeah, no, we'd have to have a script from a
script.
person's doctor. Yeah. So now we can give it under our standing orders, which our medical director just writes one standing order for anybody who comes in that meets the criteria. So we don't have the vaccine yet, but we'll be holding those as soon as we can.
Gives you the vaccine, is it?
We
the
buy
state?
No, we buy it from the
Directly.
manufacturer. Yeah, yeah.
Okay,
More to come on that.
yeah, thanks.
Thank you.
Anything else?
Make a motion.
Second.
All in favor, say aye.
Aye.
Aye, and you're adjourned until next month.
Recording stopped.